So the first thing I want the trainee to identify is the ovary and the tubes. So they should be able to point to this, right?
Okay.
I want them to identify the infundibulopelvic ligament, or the IP ligament, which is this ligament here. I want them to identify the round ligament, which is here.
Okay.
And then I want them to identify the ureter, which is down here.
Okay, so you're gonna ask them to point on each one of them.
I think so.
Yeah.
I think that's the task, yeah. I don't know what Reza did, but that's, I guess, I don't know. How did he do it?
He didn't do it, but I'm gonna ask him to do this as well.
Okay.
It's
And then I'm gonna say the goal. So the goal of the exercise is you're disconnecting the ovary from its blood supply. So that runs, the ovarian vessels run in the infundibulopelvic ligament here. So our goal is to skeletonize or isolate this vessel. You want to separate it safely off of the ureter down here. And there are vessels deep to this. So this is called your peritoneum, your pelvic peritoneum. It's a thin, filmy layer. And in order to skeletonize this, we have to open this parallel to the infundibulopelvic ligament. Once we open that, we're gonna make a window on the, so this is the medial leaf of the broad ligament, and what you wanna do is create a hole here and a hole here, and basically then you have created a hole so you can put your instrument around the vessel, and when you put a hole here, you know you're above the ureter, and that way you have almost no risk of injuring the ureter when you do that. So this is called the retroperitoneal approach to the infundibulopelvic ligament. So the way you would start is you grab with your grasper the pelvic peritoneum. You want to be lateral. So now I should clarify, we were looking at the left side. So this is the left ovary, left infundibulopelvic ligament. So lateral to this would be to the left of the IP ligament. So you're going to grab this, tense it up, and you're going to cut. And it's very important to keep traction with your left hand. That helps you open it up. Now, normally you'd be doing this with some kind of energy, but for the purpose of the experiment, we're not going to do that because I want you to focus on the actual dissection. But yes, this can bleed, so you should be using some kind of energy for hemostasis. And you really want to keep that counter traction, so you open it up there. Okay, once it's open, you kind of spread it open. So you've skeletonized the lateral aspect. Now you have to skeletonize the medial aspect. So what you do is you take your instrument laterally and you go in medially here. Now the angle's a little bit weird, but what you can actually do is hold up the infundibulopelvic ligament just gently. Now this is a vascular pedicle. You don't want it to bleed. And you want to create, so again, you can do this with energy. Now there are vessels deep to here. So you want to be really superficial. You want to keep that ureter in place and keep a view of it when you make your window into this pelvic peritoneum. Same thing, you want to grab the infundibulopelvic ligament for a little traction, and you just want to gently cut lateral to the infundibulopelvic ligament. Now you know, like you could definitely cut the vessel by accident. You have to be really careful. Same thing, you want to be parallel. And once you've created that, you can actually see how you can see your instrument on the other side. So you know you've made a window, right? And now you've made this window, all you have to do is put your instrument through. You want to see the other side of your tips. So then you know you're in the hole. And you basically clamp. Now again, this would normally be a vessel sealing device, but you would clamp here, clamp and seal it so that it's final.
So is that clipper? Is that the same thing?
No, it's going to be, so normally it's a vessel sealing device. You could use clips, but what we usually do is a kind of thermal, like a bipolar sealing device or something like that.
So do you think clippers would do the same if I
we never use them, so it's just not a true...
Okay, you just ask them to pretend.
Yeah, so you pretend that this, this seals it, you seal it once. So this means proximal. Proximal means back toward the patient. So this is the specimen that's coming out. So that's toward the specimen, so that's distal. So you want to seal it once proximally. Again, see how if you go too high up, you can get the ureter right here. This is where it's closest is up here. So you wanna, as long as you're in your window, you know that you're above it. So you clip it here, or seal it here, proximally once, and then you seal it once distally, and then you seal it in the middle, and then you cut finally. And normally this device can cut, but that's what you want to do, and that's the beginning of detaching. So that's that's the task.
Right.
Okay.
So was it easy to cut it? Or?
Yeah.
Okay.
Yeah.
Perfect.